Hi, everybody. My name is Josh, and I'm going to be one of the co-hosts here this evening. I'm joined with my other co-host, if she would like to introduce herself.
Hi, everybody. I'm Tiffany.
Hi, Tiff. So you might be wondering, where am I? What am I doing? You're at ScienceTalks. And what is ScienceTalks? ScienceTalks is a series of online informal talks where anyone can come and explore some of the latest ideas in science, research and technology. And the cool part about these talks, you've probably experienced similar things, maybe watched some YouTubes, is this is designed where you can engage with the speakers. And it's not just any speakers. These talks are given by experts in the field, and we'll introduce our experts in a little bit here. And we're providing a forum for some stimulated discussion. So bring your questions today, bring your full self, and take notes during the talk. No questions are unallowed here. Unfortunately, we don't have time for every question, but we'll definitely be able to tackle your questions. So let's get to it and explore ideas in research and science. Might have to introduce a few rules first. For those of you, it looks like most of you already have, please mute your microphone. However, we love to see your smiling faces. And in fact, at the very end, we will do a group photo with everyone after the question and answers to finish off. You can use the raise your hand feature during the Q&A or submit your chats, and we have a couple people monitoring the chats to make sure that your questions get brought up. Just letting you know that today's event is being recorded and streamed live, so you're all famous, and so don't forget to smile. Yes, so move on to the next point. And so we want to have civil discussion here as a group. This is a conversation with an expert. This is not meant to be a debate and bring people down. We're welcoming a wide range of questions from everybody here, and Science Talks encourages equal participation within a safe environment. And this is meant to promote curiosity, open-mindedness, discussion, inclusion, and generosity. And so please leave agendas and self-promotion at the door, and bring your sense of wonder and curiosity. That's what's encouraged here. All right, Tiff. Just in case you haven't read the intro page, the expert that we're engaging with today is going to be starting us off. We're going to have a talk, and again, she's just about to be introduced. Then we'll have our Q&A. There'll be a conclusion at the end and a group photo, and that's it. It's not meant to be this huge, giant lecture. It's meant to be a lot of discussion, and I'll let you guys get back to the rest of your evenings afterwards. So pass it over to my co-host, Tiff.
Thanks, Josh. I just wanted to do a quick thank you. We received our initial financial support from the City of Abbotsford and the Vancouver Foundation and the Abbotsford Community Foundation through a Responsive Neighborhood Small Grant Fund. It's a project that encourages the neighborhood to create creative projects to help us connect and build our community. And yes, and we have a couple of other private and public institutions that participated as well. I want to give a huge shout out to our two gold sponsors, the University of the Fraser Valley. They're helping you achieve all of your academic needs, as well as the Abbotsford Tech District for bringing innovation into the Valley and beyond. So our speaker coming up is Cindy Jardine. We'll be hearing from Dr. Cindy Jardine today. Dr. Jardine is a Tier 1 Canada Research Chair at Health and Community at the University of the Fraser Valley. Her research interests are multidisciplinary, focusing on improving dialogue on health risks. Much of her work is conducted in partnerships with Indigenous people and newcomers to the population. Dr. Jardine will be discussing concepts related to managing the risk posed by pandemics with emphasis on our current COVID-2019 outbreak. Specifically, she will be discussing the use of primary measures and, and how to prevent. Some of her other interests, as I found out about Dr. Jardine, was that she is a motorcyclist and a skydiver with almost 2,000 skydives and several world records, as well as an avid knitter. So please join me in welcoming Judy Jardine. Welcome, Judy.
Oh, hi, it's Cindy actually, Tiffany.
Sorry.
That's okay, I do the same thing all the time. I'm really happy to be here. Tiff, if you could just stop sharing those slides, I'll get my slides loaded up.
Thank you.
There we go. Well, thank you very much for those wonderful introductions. I am very honored to be the first speaker in this wonderful series of science cafes. As Tiffany mentioned, I have an interest in risk, both professionally and personally. But my interest in risk really extends to how we talk about risk, how we communicate about risk, and how we behave in response to different kinds of risks. Hence the topic, my topic tonight. I want to talk about pandemics, and I want to talk about the precautionary measures that we take in response to pandemics, and then focus on some of the challenges that happen when we take precautions. Let's start out talking about precaution. Precaution, as defined by the dictionary, is any measure taken in advance to prevent something dangerous, unpleasant, or inconvenient from happening. We generally think precaution is a good thing in our lives. We take precautions every day. We hold the handrail when we go downstairs. We wear a helmet when we get on a bicycle. And we take precautions as a society and a country on even wider scales like that. We fully fund a military force as a precautionary measure to just in case something happens where we might need a military. We have regular earthquake drills in BC all the time as a precautionary measure in case we ever need to deal with an earthquake. So a corollary of precaution is the precautionary principle. Precautionary principle is really something originally applied to environmental fields, but can be applied to any field, and means that simply that it's better for us to immediately work towards prevention of something that may have dire consequences, even if we don't have complete information. So in other words, the precautionary principle is what my parents told me frequently. It's better to be safe than sorry. We want to, even if we don't have all the information, I'm sorry, I have something on my screen that's driving me nuts. I don't know if you can see it or not. It's better to be safe than sorry. Even if we don't have all the information yet to tell us what might happen, we would prefer to take measures to make sure that it doesn't happen. So what does this mean in terms of our current coronavirus outbreak? Well, coronaviruses are a large family of viruses that can cause illness in both humans and animals. In humans, many of the coronaviruses are known to cause respiratory infections. These can range from a simple common cold all the way to respiratory infections such as the severe acute respiratory syndrome, or SARS, that was such a pandemic or epidemic in Canada a few years ago. COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This is a new virus and a new disease that was unknown until it appeared in Wuhan, China in December of 2019. The disease was found to spread very, very rapidly at a pace that scared public health experts, and was found to be very virulent, which meant that it had severe consequences for some people. This is found to be particularly severe for people who were older and had maybe comorbidities. Because of this, the World Health Organization declared the outbreak a public health emergency of international concern on January 30th of this year, and it was declared a full pandemic on March 11th. Now, the coronavirus really is an instance where we are practicing the precautionary principle. Although we had noticed that it spread quickly and had severe consequences very soon in the outbreak, there's an awful lot we didn't know when it first started. So there was more uncertainty associated with things, emerging knowledge, than there was actual data or evidence on the risk itself. So because of this, scientists decided that it made sense for us to be precautionary. We had some indication bad things might happen, but didn't know for sure how that would play out. In the meantime, we wanted to take whatever measures we could to make sure that it didn't become more severe. So the biggest concern was we were seeing a rapidly escalating number of cases. And I'm sure you have all seen this diagram before. So we all heard about about flattening the curve. And what this means is that you see in the red that if we didn't take any protective measures or precautionary measures, our number of cases would continue to escalate quite rapidly, and we would soon outstrip the ability of our healthcare systems to deal with sick and ill people. So the purpose of all the protective measures that we took through March, April, May, June of this year was simply to flatten this curve, to make sure we didn't get this rapid escalation of cases and we could stay within our health system capacity. And we were quite successful in this. If you see this here, comparing BC to other provinces in Canada, Ontario and Quebec, you will see that from middle of March through till the end of April, BC's measures that were taken quite early in the pandemic allowed us to flatten our curves, much more so than happened to our compatriots in our eastern provinces of Ontario and Quebec. So those preventive measures did what they were supposed to do. They stopped the number of new cases from happening so fast that we couldn't keep up with them. However, this is one of the first things that I want to talk about that is a consequence of being precautionary in a pandemic. We often call it the paradox of prevention. And what it means is that when it works, when we are taking proper preventive measures and we are being precautious about something, nothing happens. Now that's a good thing. That's what we wanted to happen from the beginning. So in fact, what happens when we are precautious is that we turn our predictions into a self-defeating prophecy. In other words, the prediction prevents what it predicts from happening. This is also called the prophet's dilemma. A prophecy that is given then causes people to take action such that that doesn't happen, and thereby you have the dilemma of the prophet who prophesizes something that never occurs. Now, this shouldn't be a bad thing under normal circumstances. However, as this graph shows, once our efforts start working, once we change that curve from a rapidly escalating number of new cases to a slower curve or even a decrease in the number of new cases, we get people saying, see, it wasn't so bad. We overreacted. Maybe there wasn't a risk at all because we didn't see any risk. We didn't see any of these dire consequences that experts were predicting. This has led to a number of problems that I think we can all have all seen in the news lately. We've created a bit of a divisive society in many places, and we see it much more in our neighbors to the south right now. We have people who are saying that we cause needless panic with these precautions, and then we have others saying we're taking inadequate precautions. We need to take more precautions or keep taking the precautions we were to stop bad things from happening. And we end up with people being not always kind to each other in these debates. It also makes for a very ripe field for conspiracy theories. And I'm sure we've all seen many of these in the news and elsewhere. You know, wasn't the virus made in a lab? Wasn't it done on purpose? It's a plandemic. It was planned to happen. It's all Bill Gates' fault. It's caused by the 5G network. No one even knows anyone who's had COVID-19, so it must be a hoax. Consistent with that, if people think that it was all done in vain, we find other unwanted behaviors happening. People saying that they're not going to take precautionary measures because it is their individual rights not to take them, and they don't need to because obviously there was no risk. We've created a bit of a false sense of invulnerability by focusing many of our efforts on elders and people with comorbidities. And we now have a case where younger people think that they're not the ones who are going to die, that they are, if they get the disease, it doesn't mean anything. Or they won't get very sick, or there's going to be no dire consequences for them. However, this is a very selfish point of view because while young people may not get as ill and die as older people will, they are in contact with older people, they are in contact with vulnerable populations all the time and are putting those populations at risk. We've also had a whole bunch of people try and find things that will be a therapeutic measure or a preventative measure for COVID-19. Things about hydroxychloroquine and other things that are unproven preventative treatments and therapies. However, in BC, we're starting to see the fallacy of some of these assumptions. You know, since we were very good at controlling the disease up until the middle of June, but as this graph shows, that since then we've had a rapidly escalating number of new and active cases again, and we're starting to see our death rates rise. What's even more disturbing about this is that while originally the disease was found primarily in older segments of the population, we are now seeing that up to August, as up to August the 8th, as this graph shows, that a very young segment of the population now makes up a predominance of the number of new cases in BC. The second unwanted consequence of precaution can be that there are secondary risks. And this just means that a different risk is created as a consequence of dealing with the original risk. Somewhat like this cartoon. By putting water on a house where there's no fire, we cause a lot of water damage, but there's no fire that's actually happened yet. So we've prevented the fire from happening, but all these secondary risks have occurred. Now, unfortunately, with COVID-19, we've incurred a lot of secondary risks that are of concern to people. Perhaps the one we hear the most about is economic risks, that as we get the virus under control, as we get the spread of it under control, we've had severe economic consequences for some people. I personally have a friend who's a travel agent, and I know that she is in despair sometimes as to whether she will ever be able to return to her original career path and what she's going to do in the time being when there's very few people traveling and needing her services right now. We've had some unintended health consequences as well. We've been noticing higher suicide rates, a result, it's hypothesized, of some of the mental stress that has accompanied COVID-19, the unknown nature of the disease, all the restrictions around it, the isolation of having to stay in our homes and not socialize like we used to. We've seen escalating rates of domestic violence. Our education system has been derailed, and we know that education is one of the major social determinants of health. We're seeing shorter lifespans. We've had an increase in deaths in both British Columbia and Alberta, unrelated to COVID-19, that is as yet somewhat unexplained. And we've seen a decrease in some public health services that we've relied upon as workers are being used in other areas, as more people are working from home, You're not able to get an appointment with your doctor. You have to do it often over Zoom or remotely. So many things that have impacted our health from COVID-19 that are not directly related to the disease itself. In BC, one of the things that's been very disturbing is that we have seen an increase in overdose deaths. And these are primarily, I heard today at another COVID-19 conference, a result of illegal drugs, not illegal drugs, is the primary cause. And they think that it might be a result of people no longer being able to access sites for safe usage or counseling, but whatever. Overdose deaths in BC have increased dramatically, as you'll see, from January of this year until May. So I want to leave you with just a couple of messages here. Nothing happening is a good thing. Sometimes we forget that. Sometimes we become focused on how difficult it has been with all the restrictions and how difficult it has been for some people financially, and we let our guard down. But this is a new poster from the World Health Organization. And as it says, COVID-19 is merely biding its time, waiting for us to let our guard down. If we want nothing happening to continue, we're going to have to continue to be vigilant about all of the measures that we took in the past, about our social distancing, wearing masks, and make sure we don't get too complacent simply because it seems like everything is safe when we have the disease under control through the measures that we're taking. Nothing happening is a good thing is also something that governments and larger bodies need to be considerate of. One of the things that has happened with the United States was when Donald Trump took office, he reorganized the Global Health Security and Biodefense Unit that was created by President Obama. Consequently, the pandemic response team was largely disbanded through this reorganization. Again, he thought that disbanding the pandemic response team was warranted because nothing bad had happened. We weren't in the middle of a pandemic, there was no pandemic forecast, and there was a lot of resources being put into something that didn't seem to be doing anything because nothing bad was happening. The second thing that I'd like to emphasize here is that we need to keep our eye on the ball. We need to keep our eye on what are we trying to achieve through this pandemic. I think what we're all trying to achieve is health and safety for our population. But it means we have to always reconsider what is it that we really value as individuals, as a community, as a society. The economic hardship has been very real for many people, and while measures are being put in place to mitigate it, it's often not enough, and my heart goes out to everyone who's been adversely impacted in that way by this pandemic. However, I think we also need to remember that our health and human lives are ultimately the most important thing, and they are the things that we can't mitigate. They're the things that we can't get back once they're lost. Had this pandemic not been brought under control, we would have had an economic downturn regardless, simply because of the widespread cases of the disease and the huge toll that it was taking on our lives and those of the people that we loved. So I want to leave you with this slide. I was in an all-day COVID-19 conference today, online conference, and someone brought this slide in and I just had to add it to this. This is Pooh and Piglet talking to each other. But how will we know if our pandemic guidelines work? Asked Piglet. The world will think we overreacted, said Pooh. So when we're right, everyone thinks we're wrong. Welcome to public health, said Pooh, and Piglet understood. So thank you very much, and I welcome any questions.
All right, thank you, Dr. Jardine, for sharing with us. While we wait for some questions to start coming in, obviously this is a very current, relevant topic. I had a quick, lighthearted question for you. What are your world records in? I had no idea about this.
I made a number of world records for the largest formation within category. Only one of them still stands, and it's the world record for the most number of women in formation. It was 181 women from 31 different countries.
Wow.
And it's not yet been broken, so.
Where did that take place?
California.
Oh, wow. How do you arrange something like that?
With great difficulty. It was even harder to arrange because we decided that we needed to make it more meaningful by doing it as a fundraiser for breast cancer research. So it was more complicated to arrange, and we all had to wear these outrageously pink jumpsuits to show our support for breast cancer research, but it was well worth it and one of the most incredible experiences I've ever had. So. Oh
man, that's amazing. I see there's a few questions starting to pour in, so I'll start asking a few of them. One person has asked, where has your research taken you? Are you currently in Abbotsford?
I'm actually in Chilliwack because I am part of the Faculty of Health Sciences at the University of the Fraser Valley, which is located on our Chilliwack campus at the Center for CEP, Canada Education Park there. The research that I'm currently doing in this area was funded by the Canadian Institutes for Health Research in their original opportunity for rapid response research in February. And we're actually looking at some of our newcomer populations in the Fraser Valley, and what they're going to need to do when this pandemic is over to travel safely when they go home to visit their friends and relatives in their countries of origin.
Okay, awesome. Okay, I got another question here. Why is it that most agree on some sort of military protection as a sort of precautionary principle, but then when we're asked to wear a mask as a reaction, it's so much more of an emotional response that comes from that?
I think that having a military, people don't think infringes on any of their personal rights and ability to make personal decisions about their health and well-being. Asking them to put on a mask, many people have said, is an infringement of their individual rights, that they shouldn't have to wear a mask if they don't want to. They should be able to make decisions about their own safety. But we're really in a situation right now where the measures that we take are not for our safety so much as they are for the safety of everyone around us. It's not a time to be altruistic. It's not a time to be selfish in our responses. This is a time when we have to realize that there are consequences, and our individual rights are completely overtaken by the greater good.
Perfect. When studying it, you're quite involved with this field. When you're studying pandemics in particular, what pandemic research has been instrumental in knowing what to do?
Oh, there is so much going on right now. That's a very tough question to answer. And as I say, I was in a conference all day listening to all these amazing researchers in BC doing incredible work. I think one of the main things has been the ongoing conversation and research about wearing masks, which I realize has been very confusing to people. And from the point of view of being a risk communication researcher, I understand why it's confusing, because the message has changed. But so has the research. We now know that masks are actually more effective than we'd ever known, never thought they were before, because we've done so much research on it. And we also understand that wearing a mask, if everyone wears them, it does have a really notable effect on the transmission of the disease. So I think that's one of the big things. I heard a really interesting talk today about hand sanitizers too, and some of the things about hand sanitizers that, while they're good for what we're doing and they're applicable in some reasons, things that we need to be careful of in hand sanitizers, and making sure they don't come in contact with food, we don't accidentally ingest them, We don't put them in colorful packaging for children that makes them look like juice boxes. So I think there's lots of interesting research. I don't know if there's anything that stands out for me so much, with the exception, of course, of all the work that we're doing to get a vaccine and to get more accurate and rapid testing, all of which is also underway.
Okay, and prior to COVID-19, what sort of pandemic research it has been the most relevant? Is there a certain pandemic, like Ebola, or is there a certain disease that has kind of been the guiding light for how people reacted in a certain situation?
There was quite a bit of work done in Canada, mostly around SARS and H1N1. Of course, Toronto was one of the places that became one of the SARS epicenters, which gave us further incentive to do that. But we learned an awful lot about transmission during H1N1. We learned a lot about what we need to do in terms of precautionary measures. It was one of the first times in a long time that people were actually asked to quarantine if they had been in contact with anybody with the disease, and some of the ramifications that came out of that. So we learned a lot through SARS. H1N1, much more widespread, but not quite as virulent. So every pandemic is different, and that's what makes this challenging.
Okay. We have a question from the audience here. How do you determine what level of precaution is optimal? They've just made the point that too little precaution is useless, too much precaution and secondary risks outweigh primary risks. What is that? How do you determine that?
Well, it's I think an educated guess. I think as you start to get things under control, that you loosen things up a little bit. The hardest part is getting people to stay in sort of that heightened awareness state, right? Of, okay, I can be a little bit, I have a little bit more freedom than I had before, but that doesn't mean I can go wild with it. That this is always, it's always there. It could always come back, and we just need to, we want people to be a little bit anxious still about it. And I think that's where government agencies and others right now are trying to put their emphasis. They're trying to say, you know, look, we're trying to get back to normal, but please don't think we're there yet. So as we flatten that curve, we loosen things up a bit. But if we loosen it up too much, we're going to have a problem.
Okay. And another question here. Are you willing to pick a guess to the soonest date that we might have a vaccine?
Well, it would just be a guess. Hopefully it's an educated guess. I really can't see that we're going to get through the levels of testing required to make sure we have a safe vaccine until probably sometime in the second quarter of next year would be my guess. I think Canada's making every effort to make sure we have access to a vaccine as soon as we deem it safe. You know, having now made arrangements with 3 major companies or institutes looking at developing a vaccine, but that's my best guess. We're not going to go back to any new normal till April or May next year.
That's fair. And once they've developed a vaccine, what is the typical time frame before that can be rolled out to a population like Canada?
I think the biggest concern for any country is making sure that the vaccine is safe. We don't want to do what Russia has done and release a vaccine before it's gone through all the required levels of clinical trials. So I think it's going to be making sure that the Public Health Agency of Canada and other people responsible to that are satisfied that all safety mechanisms are in place. And as soon as they do that, it will be available to Canadians. How long that will take, I think, depends on how vigilant the companies developing the vaccine have been in their testing protocols.
Okay. So with fall coming up on us right now, we're now officially in September, which is crazy. If you get simple common cold symptoms, it's suggested that you self-quarantine, but should you get tested for COVID additionally?
I think right now, because some of our biggest emphasis is on trying to keep exposure down for other people, if you're exhibiting any symptoms that might be consistent with COVID, I would encourage you to get a test and self-quarantine until you're sure that you do not have COVID-19. I think that's just being precautionary.
This is very related to that. What effect would having a flu shot have on minimizing the effects of COVID-19?
Almost none, except that you don't want to be sick and then be weakened by the flu such that you might be more susceptible to COVID-19 would be the only thing. But the flu shot itself isn't going to minimize your chances of getting COVID-19. It's a completely different virus than is currently accommodated in the flu shots.
It sounds like there's some value there, though. We're not dissuading flu shots.
Well, you know, you're always more susceptible to another disease when you're run down, when your immune system is in some way compromised. And I don't know about anybody else, but I'm pretty run down and immune compromised when I have the flu. So I'm going to get my flu shot just because I think it's one thing that makes me a little bit more robust in terms of not getting desperately ill with COVID-19.
Okay. And when you're getting your flu shot from a nurse, this is very relevant to those nurses, but also to the general population. Is the level of PPE being provided for healthcare workers adequate, in your opinion?
That's a really hard question to answer. I think things are better now. We were really caught off guard at how quickly this disease spread in the early stages. And obviously, the personal protective equipment was not there in the quantities to make sure that healthcare workers had access to a new fresh mask, for example, new fresh N95 mask every time they needed one. I think that's much better. I think we have learned from this situation. When you asked, what do we learn every time we have a pandemic that we apply to a new one? This is going to be one of them, making sure that we're not going to be caught short of these things again should another pandemic arise.
Okay. This is a question having to do with, I guess, moving away from the current state that we're in, but what percentage of the population needs to be vaccinated to achieve herd immunity?
The experts don't have an exact number, but they like to say between 80 to 90%. We do recognize that there are always going to be some people that for whatever reasons can't be vaccinated, and that's who we're trying to protect. So that everyone who can be vaccinated and can gain that immunity will protect those people who for whatever reasons can't be vaccinated or are at a higher risk. So I wouldn't want to give that as an absolute figure. We would like to get it as high as 95 to 98%, but realistically, if we can get up to 80, 85%, we're doing pretty good.
Okay, awesome. So we got a little way to go.
Yes.
What symptoms would differentiate COVID-19 from, say, the flu?
Oh, wow. So I'm not a medical doctor. I'm a public health person who studies behavior and communication. I would encourage people to look at the Public Health Agency of Canada site, at the BC Ministry of Health site, and make sure that they are up to date with what the COVID-19 symptoms are. This is a disease we're learning more about all the time, which is why it makes it hard to be precautionary, because we're not sure how severe things are. So we're learning all the time of different kinds of symptoms. We're learning about more prolonged symptoms than what we would have anticipated from this. My understanding is the major symptoms are a cough, a dry cough that just won't go away, fatigue and fever. But that doesn't mean that those are the symptoms that you'll have and that you may still have the disease. So.
Okay. And so this is more a policy issue. It seems that the precautionary principle requires us to trust in experts and science, but expertise has been under fire recently. and how can we restore this trust in experts?
You know, I think in Canada, we're a bit different than maybe what we see on the news and what's happening in the US all the time. Research and surveys that have been done recently have actually shown Canadians do trust science and do trust the experts. We have a phenomenal amount of trust, particularly in certain people who we think share our values, who are wanting to do what's best for us and best for our communities and society. So I don't think we universally distrust experts in science. I think that it really depends on the atmosphere that's set by the people in charge and the people who are communicating as to how much trust we have. I think we've been extraordinarily lucky in BC to have Dr. Bonnie Henry. You know, her approach of be calm, be safe, be kind is a really unique one. She hasn't lectured anybody. She's tried to tell us these are the things that are important to us as individuals, as a community, as a society, and these are the things that we need to follow. And this is why we need to trust in experts in science, because we want to preserve those things. So I don't think our trust is so bad in BC right now. We do trust our experts. I think they have an uphill battle in other areas where experts have been under fire, where they're getting a lot of mixed messages from people who should be in a position of trust, sometimes undermining experts and undermining expertise. What we know from the risk communication literature is if there's too many mixed messages, people will just adopt inaction because they don't know what to do. And sometimes they think doing nothing absolves them from having to make any decisions about who to trust and who not to trust. It's always sad to see that happen. What we need is consistency from our scientists, and I think we're getting that for the most part.
Okay, perfect. And I agree. There's a lot of trust in Bonnie Henry. I hear a lot of people expressing praise for her. For those of you who don't know, I believe she got her experience in, was it Ontario responding to SARS or
H1N1?
H1N1. That was it.
Yep. Yeah, she did. So we got a seasoned veteran when Dr. Bonnie Henry came to BC. But I am extremely proud of the fact that she got written up in the New York Times as an exemplary communicator for COVID-19. I think that really says something about us.
Yeah, we can have some BC pride there.
Absolutely.
A couple more questions here. If you do have symptoms and you get a test, what are the chances that you get a false positive or a false negative?
I have no idea. I'm so sorry. Completely outside of my area of expertise.
No worries. Is there a resource that you would recommend, BC or Health Authority, or would you recommend the UN or the World Health Organization? That what's the top resources there right now?
Well, you know, I always go to the Public Health Agency of Canada or to the BC Ministry of Health, because I think that they are you know, working in our best interests for Canadians. The World Health Organization is certainly a very valid and credible source as well. I don't know if any of them actually have that information on their sites or not, but it would be interesting to pose the question to them. I think because there's so many different kinds of tests or tests that are being experimented with right now, trying to get us a more rapid test, something that's easier to administer and that we get the results more quickly from, that number is going to change as well, because those kind of statistics can only be found out with a vast number of people having the tests.
Okay, perfect. This is a question that has to do with your presentation. You talk about a secondary wave that appears to be coming up, and there's a risk in that it being mostly young people this time. Why is that particularly concerning?
It means we've got a greater segment of the population who's infected and who is going to infect other people. The younger people who are being infected are the ones who are, for the most part, not thinking about social distancing, not thinking about wearing masks, thinking that they can do that because that they have a certain degree of invulnerability. But the problem is that they come into contact with so many other segments of our population. And if a large portion of that younger group gets sick, even though they might not have as severe consequences, they are going to come in contact with people who will have severe consequences. So it's more disturbing because it is a segment of the population that does tend to have more exposure contact with the greater population than the old folks who know enough to stay at home and to wear their masks in public.
Okay, perfect. Could you tell us a little bit more about what the precautionary principle looks like? Is it based on some sort of statistics? And how does it look like in the case of COVID? I know that's it's a couple different questions there, but
yeah. So the precautionary principle is almost an ethic, right? It's an ethic of if the consequences are unknown, but we have some reason to believe that they're not good, then we should take precautions to stop them from happening. We have to realize that the precautionary principle, though, has to be dynamic. It means that as we get more evidence in, as we know more about the disease, as we know more about the virus and transmission and symptoms and consequences, that we need to constantly be reevaluating what we're doing to see if it's still valid, if we need to take more precautions, different precautions, less precautions in some area. It's not static in any way, and it's something that we are going to apply differently and to different intensities throughout this COVID-19 pandemic that we're seeing. So no, it's not based on statistics. It's one of those things where, again, because nothing bad happens, we have no way of actually measuring what might have happened should we not have been precautionary. I had a philosophy professor who used to call it trying to prove the counter negative. Trying to prove that what you said would happen if we didn't do this would actually have happened. Well, we can't. But likewise, the whole basis of the precautionary principle is, do we really want all those bad things to happen? So we do have the statistics and we can prove that they would happen, because that to me is not the place that we want to go to with this, especially with an outbreak like this. We don't want it to become the Spanish flu that killed 50 million people. You know, and we're doing our very best to make sure that we contain it enough that we don't have that massive mortality that happened back in 1927. And that's hard because we live in an area or in an age that's much more connected, where people move from places, between places, and travel much more frequently, and chances of transmission are much higher than they were in 1927. So.
We definitely do not want another Spanish flu. But thank you for answering these questions, Dr. Jardine. And before we end our question and answer period here, is there a message you'd like to give those listening, or a message of hope, something along those lines?
Well, I feel like I've been sort of Captain Obvious tonight. I've probably pointed out a whole bunch of things that people go, well, yeah, I guess, I knew that. That just makes sense. My purpose tonight was to make you think about it in a different way, to not get complacent just because things seem to be getting better, to still be cautious until we have some sort of valid vaccine available that's going to give us the immunity that we need. So let's hope nothing bad happens in the future, but it's going to take our efforts and the efforts of our governments to make sure that that happens. So.
Perfect. Thank you, Dr. Jardine, and thank you, audience, for bringing some amazing questions here today. That ends the question and answer period. We have a couple more things that we'd like to do with you before we end here today. we'd like to say a thank you to some of our sponsors that have helped make this series a possibility. And I'd like to pass it back to Tiffany.
Yes, we need to do a huge thank you to our supporters that are helping us spread this valuable knowledge through our community. It's so important for everybody to have the opportunity to come out and listen to this, and we couldn't do it without UFE and the Abbotsford Test District. They have always been huge supporters of ours, and we couldn't thank them enough. As well, we have some exciting upcoming talks on the future of agriculture, innovation, as well as Indigenous history. So don't miss out on those. It is the first Tuesday of every month. You can find all of the details on our website, as well as on our social media. Give us a follow. We want to help spread this knowledge throughout the rest of Canada, and we would love your support. So you can always find us on Facebook, Instagram, as well as YouTube, where we will put our talks up there after.
Perfect. So thank you. Again, just want to let you know that this event is only possible with our community sponsors, and these events are all totally free. We'd just like to make you aware that on our website, ScienceTalks.ca, we do offer an area that if you think this has been beneficial and you would love to support this, this format, we've given a link here for ways to help donate if that's something you want to do. We appreciate any sort of support you're able to give. But again, the best way you can support us is by sharing and telling people and bringing them out. So thank you again for coming. Check us out on ScienceTalks.ca if you're wondering where the next talks are, any sort of information. We want to give another thank you to Dr. Cindy Jardine for joining us this evening. And we want to thank you for giving your time this evening and joining us. And that is the end of this evening. So